So now we're going to briefly describe the neurovascular supply to structures of the female reproductive system. Let's start with the ovaries. The ovaries have an unusual blood supply in that they are not associated with the internal iliac artery or the internal iliac vein. The arterial blood supply of the ovaries and the fallopian tubes is by the ovarian arteries. These branch from the abdominal aorta just below where the renal arteries are given off. This can be explained by the ovary's descent in the abdomen during embryological development. The ovarian arteries travel within the suspensory ligament through the broad ligament of the uterus to reach the ovaries. There they anastomose with the uterine artery within the broad ligament. Similarly, the ovarian veins have a long path within the abdomen. The ovarian veins drain the fallopian tube and the ovaries and travel posteriorly through the suspensory ligament. The right ovarian vein ascends to drain directly into the inferior vena cava, whilst the left ovarian vein ascends to drain into the left renal vein. This can be explained by the fact that the inferior vena cava lies to the right of the midline within the abdomen. The ovaries have their own nervous supply via the ovarian plexus nerve that travels alongside the ovarian artery and vein within the suspensory ligament. This also supplies the fallopian tubes. The lymphatic drainage of the ovaries is via the para-aortic lymph nodes. The rest of the female reproductive organs all get their arterial blood supply from branches of the internal iliac artery. Some of the important vessels that branch from the internal iliac artery are the uterine artery. This travels within the cardinal ligament to reach the cervix, where it ascends along the lateral aspect of the uterus. Here it anastomoses with the ovarian artery. It supplies the uterus and cervix and part of the superior vagina. The vaginal artery, which supplies the vagina and has additional branches to the inferior bladder and rectum. And finally, the internal pudendal artery. This is the main artery responsible for blood supply to the perineum. The paired internal and external pudendal arteries supply the vulva. Excluding the ovarian veins, the veins supplying the female reproductive structures drain into the internal iliac vein. The important venous vessels that drain into the internal iliac vein are the uterine vein, which drains the uterus and cervix via a plexus in the broad ligament, the vaginal venous plexuses, which supply the vagina, and the internal pudendal vein, which drains the vulva and part of the rectum. I've just included a table to highlight the different lymphatic drainage and nervous supplies of the other reproductive structures in the female pelvis.